My name is Srikumaran. I'm an orthopedic surgeon with Johns Hopkins and Howard County General Hospital. I specialize in shoulder surgery. The rotator cuff is a set of 4 muscles and tendons that attach your shoulder blade to the proximal part of your arm, or the proximal humerus. It serves to stabilize the shoulder in socket and also helps lift and rotate your arm. Common injuries to the rotator cuff include inflammation of the tendon itself or the surrounding tissue. It's called rotator cuff tendonitis or subacromial bursitis, or more significant injuries such as tears. These tears can be small or partial in size, or they can involve the entire tendon in full thickness and be quite large. They occur because of wear and tear as we age or from acute traumatic injuries. Treatment for rotator cuff tears can involve simple measures such as rest and activity modification, so avoiding activities that are painful for your shoulder, to things like physical therapy and icing your shoulder, and pain medications such as anti-inflammatory medications like ibuprofen and aspirin. Surgery is a good option for treatment of rotator cuff tears when non-surgical measures such as physical therapy and pain medications have failed to provide symptomatic relief over a period of time. Other reasons for surgery include a large tear or tears that have resulted from an acute traumatic injury. Finally, if you have a high demand occupation that requires a lot of overhead shoulder activity, this may be another reason to consider surgical fixation. So the surgery is typically performed arthroscopically, although an open incision may be needed in rare cases. The arthroscopic approach uses small incisions around your shoulder to insert a camera and arthroscopic equipment to perform the work. The goals of surgery are to remove inflammation, remove diseased portions of the rotator cuff, and repair the rotator cuff tendon back into bone. Recovery after surgery can be lengthy and can progress over several months. Typically, the patient will be in a sling for 4 to 6 weeks after surgery, and physical therapy will begin 2 to 4 weeks after surgery and continue over several months. Physical therapy is usually individualized and prescribed by the surgeon after the surgery is performed. In general, however, the patient starts with passive range of motion exercises where motion is generated by the therapist, and later towards active range of motion where the patient performs the range of motion exercises. After range of motion has returned, strengthening exercises can begin. The prognosis for rotator cuff repairs is excellent, particularly in terms of pain relief. Functional results can continue to improve even out to 1 year. The majority of patients will return to a high portion of their activities within 4 to 6 months, including sports.